Smoking history plays a key role in determining lung cancer risk. Regular screening is crucial for high risk individuals.
Patients who are at high risk would be patients who have had a smoking history of more than 20 pack years. By 20 pack years, I would mean that someone who smokes one packet of cigarettes daily, that is 20 cigarettes in a day, daily for the last 20 years, would be classified as a patient who is having history of 20 pack years. So all patients between the age group of 50 to 80 years who are having greater than 20 pack year of smoking history would be eligible for screening. This would also include patients who are current smokers and also patients who have quit smoking, but the time interval from stopping smoking to now is less than 15 years.
Guidelines for lung cancer screening emphasize early detection using modern techniques. Low dose CT scans are at the forefront of these recommendations.
So basically, there are a lot of guidelines that are coming around the screening of lung cancer, especially in the Western countries. We have the NCCN guidelines, we have the American Cancer Society guidelines, as well as we have the US PSTF, that is the United States Preventive Service Task Force guidelines in place. But the one thing is they all share together is the modality of screening for lung cancer in today's era. It is just low dose CT scan of the chest that can be utilized for screening purposes. X-ray has been proven to be an inferior modality for lung cancer screening.
Lung cancer treatment has evolved significantly, offering new hope even in advanced stages. Today's therapies promise better outcomes and extended survival.
So, lung cancer remains to be a very common disease in the Western world as well as in India. And obviously, this is something that is smoking related. So, one thing that I can, tell you all is that quitting smoking would definitely help reduce the occurrence of lung cancer. Second is that whenever, if any person develops a lung cancer, that is not the end of the road for him. In today's medical oncology era, we are having a lot of immunotherapies, targeted therapies, and other therapies that can, be put to use for patients. And even for patients who are having stage 4 lung cancers, the survival may be increased up to 8 to 10 years. That is the level of benefit or magnitude of benefit that we have been able to achieve. So certainly more and more therapies are coming in, more and more affordability issues are being resolved by the government, as well as the patient assistance programs that are coming up for help of patients. So definitely this is an era that is seeing a continuous change. A lot has changed since the last 5 years, and I'm pretty sure much will change in the next 5 years. So optimism should always be maintained. And whenever you face a stressful scenario such as a carcinoma of the lung, so it is worthwhile that you study about the disease and you sort of get seen in by a proper medical oncologist.